Hi, good morning, everybody. This is Andrew Lau, LOWSUTEA president. Hi, everybody. I was so happy to see many of you. We have people from different places all over the world, from people from Hawaii, from Singapore, from Philippines, Hong Kong, different places. And today's topic is going to be very related to all of you. There's a reason why. We found that many people, especially in age, constipation become a things of life for many people, especially for diabetes and for people who are from either diabetic or they are age. Constipation tend to have with you, and so many become frustrated with the constipation because what can you do? If you're stuck, it's a very sad emotional issue. And so this is something that I think will be really nice if we can able to help people to give some tips to help them out. And that will be tremendous, wonderful. And that's why we did this seminar. Hi， 各位朋友，我係 Angela 老師 President， 今日好高興啦，有好多人咧有不同地方啦，有 Hawaii 啦，有Vancouver 啊、新加坡啊、羅省啊、加州啊、菲律賓啊、香港啊，咁好多人 join 我哋 webinar 關於即係如果你係要去大便，但係去唔到點算咧？呢個係一個係好 frustrating 嘅東西嚟嘅，即係好哇死啦，係咪真係我係去唔到咧？咁其實咧係咪真係要可以有咩 tips 幫到你可以成日去好方便咧？咁其實呢個係一個好好嘅 tips， 幫到你咧最緊要了解點每日去大便咧係好舒服嘅。同埋咧，你去唔到咧，你個人都好奄尖，日日都塞咗啲嘢喺度，咁唔知點咁。咁所以變咗嚟講，呢個 webinar 咧係好有幫助。其實我做呢個 webinar 嘅原因就係因為已經好多我哋自己嘅堂友啦，或者我哋前期患病者嘅堂友啦，同我講夜晚打返俾我 Andrew 好有唔掂嗰時候咧，好似即係有便秘嘅點算咧咁。其實咧呢啲係全部可以做得到嘅，同埋咧我哋依家俾啲方法咧。係可以好容易做嘅，亦都唔使錢乜滯嘅，即係唔使錢係嘛，自己做到啦。咁所以變咗嚟講咧，呢樣嘢咧，我希望啲 tips 係幫到你啦。Okay, so today I hope that this is going to be a fantastic webinar for all of you, can able to understand why you have constipation all the time, or as you get older and you are pre-diabetic or diabetes, because this is really related to not only diabetes itself, but also people who have, as you get older, you are going to face this problem no matter what, because of the fact that your gut and everything like that will be start going to be slowing down, and then your bowel is not going to move that much, and eventually you are going to face this constipation issue. So hope that we have this webinar can give you all these tips to help you out to become much easier to handle your constipation, and you can do it daily with whatever I've suggested today, and help you to continue move very happily and feel comfortable for the rest of your life. So this is what we're trying to do today. Okay, so I know we have so many people from different part of the world, so I need to catch up some of the people who just new to us. So I thought that we'll give 5 minutes to start kind of what is diabetes, okay? Now, diabetes, as you know, is a chronic disease. You don't get well. Only thing you can do is control. And you have to, everybody do the same thing from pre-diabetic diabetes. They will actually look at what is your A1C. And A1C is your red blood cells with a percentage of glucose or blood sugar attached to it. And people, all doctors measure this one to see how are you doing with your blood sugar. So you have to keep your A1C below 6.4%. If you are diabetes, if you're pre-diabetic, you have below 6.4 all the way down to 5.7. Now, how do you control your blood sugar? Basically is by your dieting, your exercising, and your weight control, lower your weight. And certainly hope that you can continue to measure blood sugar, because the only way you can tell how well you're doing is your blood sugar measurement. And also, certainly, if good, you can listen to a webinar so you can able to better understanding, all the technique how to become to control your blood sugar. Now, certainly, if you are a pre-diabetic, you really got to cut off your soda, juice, no white food, meaning all of rice powder. Rice is really can increase your blood sugar tremendously. And then also your bun, your white bun, char siu bao, also increase your blood sugar tremendously. So really need to, put it down eat very little. And certainly LOWSUTEA will really help. And we'll explain why LOWSUTEA help you, and drink LOWSUTEA definitely help you. OK， 各位同位記住嗱，因為咧糖尿病咧就係唔會好嘅，只係能夠控制。咁如果你前期患病，你唔做嘢咧 ，eventually 你就變糖尿病㗎啦。咁應該我再更加解釋多啲啦。最重要咧，你如果係前期患病咧，一定唔好過6.4個 A1C。如果你係糖尿病，希望你由高嘅 A1C 跌翻嚟低過6.4咧，你就 very good 㗎啦。咁所以呢個係一定好重要，就係只係能夠控制點做到呢樣嘢，控制你嘅 diet 啦，即係你食材啦，你嘅控制到你嘅blood sugar 啦。食材控制 blood sugar 啦，就 weight 啦，即係磅數啦，減低磅啦，同埋 exercise 啦，呢啲嘢全部係好重要嘅。咁當然飲去頭就好有幫手啦。咁所以呢啲咧就希望咧你轉咗你個 lifestyle 咧，咁轉咗你生活習慣成個咧，咁你就會繼續係好健康計劃，全部都咁去咧，唔會變咗一個好差嘅糖尿病者，或者你唔會前期轉糖尿病者。And I really need to keep repeating this, and it's very helpful because a lot of people say, hey, you mean say it so many times already, but on the hand, they always found out that they better understand it every time I say it a little more, then they will stick in, and that's what I'm trying to do. Now, everybody goes through 4 stages of diabetic development from pre-diabetic, okay? The first stage is when your LDL cholesterol goes up, and then it would damage the B cells come from your pancreas, which is like the insulin. The insulin B cell is the cells that would take the sugar into the cells, the B cells. Now, when that damage, more and more B cells come out, then you become a lot more so-called insulin resistance, because the B cell doesn't take the sugar into the cells. And the blood sugar goes up in the vessels. And the vessels keep going out, so the sugar goes up, and the LDL goes up. You know what? The next phase comes in. Your blood pressure go up, because this is the most detrimental for diabetes. Is forming plaques on your vessels all over the body, entire body, everywhere, brain, gut, heart, liver, everywhere. So this is the most damaging. That's why diabetes will be really involved the entire body, because all these plaques start forming because your blood becomes thick with insulin, with the blood sugar and also the cholesterol. Now, then your second stage, your blood pressure goes up. The third stage is now your blood sugar continue to go up. Then the doctor is going to measure your red blood cells, the amount of sugar in percentage attaching these red blood cells. Now, we all have red blood cell, by the way. And so this red blood cell percentage become a gold indicator whether you are pre-diabetic or you are diabetes. Pre-diabetic, normal person is 5.7. Once you're over 5.7, you are starting to be a pre-diabetic. And from pre-diabetic to 6.4, you are in this range, which you need to have to manage to make sure you don't go beyond 6.4. Now, a lot of people don't realize that they don't do anything because pre-diabetic has no symptom, no problem. I can continue in my 3 scoop of ice cream. I should be not issue because you have no feel. Okay, no, not issue. But if you continue to do that, if you go over 6.4, you are converted, and eventually or keep moving up. And during this conversion, if you are no longer within half a year, most of the medical center below 6.4, they will consider you diabetes. And once you do that, you are not going to go back. And the doctor will call you, you are diabetic, and your insurance go up. So 4th stage, your become if you over your A1C over 6.4, then you are a diabetes. So this is something that I don't want you to be there. I want you to continue to be 6.4 and below. Hope that you will continue to be, in this stage. And that way, I hope that you will continue to be healthy. Now, because diabetes will never get well, you only control. So what we're trying to do here is help everybody understand how to become a diabetes and not to be there, so you can continue to control yourself in pre-diabetic stage or even below, become a healthy stage. If you have early stage of diabetes, you can do that. You know that? I have a lot of patients now was A1C was 7, 8, 9, because they start listening at webinar, they start monitoring the diet, they start exercising, they start lower the weight control. Wow, their A1C was better than me because I'm A1C is 6 from 6.9. Their A1C from 8, 9, 10, 5.8, 5.7. So it's just a matter of you want to do it or not. If you can do it, yes, you can. 嗱，各位朋友，唔好意思啊 ，sorry。糖尿患病者咧，全部有4個 stage 嘅。第一個 stage 就係呢個 LDL 嘅膽固醇咧係上升啦。咁呢個 LDL 膽固醇上升嘅時候咧，就損壞咗你個胰島素出嚟嗰啲 B cell 帶啲糖入去個細胞裏邊嘅。當你damage 咗之後咧，咁啲糖又唔落去細胞咯，咁啲糖就一路整喺個血管度越整越高咯。越整多 B cell 出嚟咧，都帶唔到佢，咁你開始有呢個叫 insulin resistant。嗱，呢個問題出現咧就弊啦，因為你糖加埋呢個 LDL 嘅膽固醇咧，啲血咧就become結啦。結嘅時候咧就第二個 stage 開始啦。咁結嘅就全身咧最大問題咧就所有地方咧開始塞咯，開始 form 啲 plaque 啲板塊喺個血管嗰度。咁呢板塊咧點解會病咧？就係因為咧，其實糖尿病最弊呢樣塞下咧，你就有啲地方咧就去唔到咧，咁有中風心臟病啊，全部出嚟嘅 eventually 未初期冇㗎。咁呢個咧你血壓一定開始上升嘅。咁上升嘅時候咧，咁你糖又上去啦，血壓上升啦，咁你開始咧第3個 station 咧就叫做前期患病者。前期患病者咧就你個 A1C 即係你個紅血球就加埋。有幾多個 percentage 嘅糖黐喺個紅血球裏邊咧？如果你5.7咧，你係普通人冇事嘅。但係如果5.7至6.4咧，你就係前期患㗎啦，即係有啲 percent 嘅糖黐喺度。咁變咗嚟講咧，如果你係乜嘢都唔做嘅時候咧，如果過6.4咧，你 eventually 就會轉咗糖尿病症。第4個 stage 咧就變咗糖尿患病者 ，anything A1C 過咗6.4咧，你係糖尿患者啦。咁所以變咗嚟講咧。我哋希望咧，由呢方面好多呢啲咁嘅即係講座啊，幫助你咧去了解乜嘢叫糖尿病。希望你就唔會去咗即係糖尿病嗰邊啦。就算你一路落去都係前期患病，哇 ，you are very good， 因為你會繼續身體健康啦，唔會有好多糖尿病嘅併發症啦。呢個先係我哋希望喺度做嘅工作俾你。OK，so I hope everybody。At least you are not going to convert. You can be continuing on years, 20, 30 years. Yeah, pre-diabetic, it's okay. But hopefully you can actually go back to 5.7, even better. So that's what I was trying to do in all this effort here. Now, why we suggest to drink LOWSUTEA? One of the major thing is drink when you are pre-diabetic. There's really no medication. Only you can do is control your diet, exercise, and also your weight, and measure your blood sugar. But a lot of time, your blood sugar continually goes up. So you know there's nothing really can help you, even though you do all that exercise, diet, and there's no medication help your blood sugar come down. So LOWSUTEA come in, become a very, very important supplement to help you to lower your blood sugar. And you really got to drink this effort to drink that. And I have a lot of people like in Hawaii with Faye Mao who actually brought down all her medication, but once you forgot to drink LOWSUTEA, you know what? Her blood sugar goes up. And she might thought that I need to drink eat more medication. But once she start drinking LOWSUTEA, the blood sugar become normal again. So very important. That's what LOWSUTEA will help you, especially when you're pre-diabetic. It does lower your A1C and help you to continue, put your A1C at a healthy, normal level. And that's what this particular low should help you. But why it works? Because what it does is guava leaf, it delays the absorption of sugar into your intestine gut. Secondly, most important is the bitter melon. It increases the insulin sensitivity. So more sugar can take into the cells. The excess sugar, you know what they do? They dump the sugar and cholesterol and also salt from the urine. So net result, your blood sugar will come down, your cholesterol will come down, and your blood pressure will come down, and it will help you to detox. So you don't really even need to be a diabetic or pre-diabetic patient drink it. You can be normal person. We have a lot of young folk drink it. They say, wow, your tea is really good. I said, why? Because they have no more pimple, many of them. Detox is the function coming along. So any people, not necessarily to be pre-diabetic, diabetic, even though they're at, whatever age of 20, 30 years old, they can drink LOWSUTEA to help keep them healthy. It's just a very good thing. It's not a drug. It's just a nice, healthy tea for you to drink. So this is really a magic of LOWSUTEA. 嗱，各位朋友，點解我成日要希望你大家飲去糖茶？個原因咧，因為咧，當你係前期患病者咧，哇，好慘喎，因為冇藥食喎，原來前期患病，你只係醫生話你去做唔好食咁多甜嘢啦，就係diet控制啦，做下 exercise 啦，或者係減下磅啦，係你做呢幾樣嘢嘅時候咧，未必 work 嘅喎，因為你冇一樣東西係幫助你即係降低血糖。同埋你嘅膽固醇啊，同埋你嘅血壓，所以變咗嚟講咧，好多人咧只係繼續都係做嗰個咧，但係唔係咁 work 啦。所以去糖茶原來真係幫咗好多糖友或者前期患病嘅係降低晒三高嘅東西。咁其實仲有一樣嘢咧，好多人咧，就算後生嗰啲飲咗之後咧，暗瘡冇埋，咁就好開心。但係佢冇糖尿病啊，唔緊要嘅。但係最緊要一個健康茶可以講得為。嗱，其實點解 work 咧？因為 guava leaf 咧，即係呢個番石榴葉咧，係幫助你將啲糖咧係遲咗入去個血管裏面，咁佢掉咗喺個糞便掉咗出嚟啦。仲有呢個苦瓜咧，將啲糖 increase 咗佢個胰島素嘅敏感度，咁啲糖咪帶翻入去個細胞裏面啦。仲有一樣嘢好嘢咧，就係將啲糖、鹽同埋呢個膽固醇掉喺個尿嗰掉出嚟，就唔會 absorb 翻落血管裏邊。哇！咁所以咧，好多人飲咗之後咧，腳腫唔見咗啦，血壓低咗啦，膽固醇低咗啦，仲有糖都低埋，咁佢身體繼續健康。所以呢個咧係一個好重要飲品咧，係尤其是前期患病咧，真係呢個會對十分有幫助嘅。Now, a lot of people say, well, I have no sign and symptom. Why should I do this? I don't need to do that, right? Because I have no any kind of problem with my typical body. I seems to be okay. But if you are pre-diabetic or you are diabetes in early sign, you are definitely have not much symptom for sure. You just see your A1C go up to 8, 7, 9, 10, and so forth. But when you get down to 9 and 10, eventually, another couple more sign and symptom comes out. What sign and symptom will come out? Eventually, you have a risk of stroke, loss of consciousness, memories, cataracts issue, eye become blur, pancreas doesn't work, insulin doesn't come out. And then the worst that it affect your heart, it blocking your heart vessels, and eventually you get a heart attack. Worse that you have nerve damage, because a lot of pre-diabetics start to get nerve damage of early signs, but older. You're going to start feeling numb of your feet, and you don't get feel. And then worse that your feet is going to get dry, and a lot of times you have pain coming along. And all that sign will come soon enough, maybe not the first year, second year, third year, you will feel all that. And if you don't get feel, you know what? Then you got loss of sex function. 30% of people lost sex function if they are diabetes. And then also another thing, injury, you don't feel, you continue to get infected, eventually lost your foot, you got to cut it off, amputation, and then it hurt your kidney. You have diabetic nephropathy, meaning that you have to end up with diabetes, you have to have dialysis. 70% of the kidney patient has some form of diabetic nephropathy, meaning the kidney are start damaging. So once you get to 30% of kidney failure, guess what? You will have to end up with dialysis. So if you're pregnant, you can have gestational diabetes. Eventually, you might end up will be a permanent diabetes. And so that's why you have to do all these things to help you out to control your blood sugar so you don't get all these complications. I hope this is really good for you. If you remember this, say, this is my motivation. I'll keep myself healthy, because you don't want to keep getting your blood sugar stuck in your brain that end up you cannot remember. I don't know if you have any relative or friends keep asking the same question every 5 minutes, the same thing, because the sugar are plugging the brain. Now they can't remember. The short memories are gone. So I have lots of relatives who have diabetes doing the same thing. And it was so frustrating for them to say, hey, my mom asking me the same question over and over again. And because you know why? The diabetes stuck the brain and they cannot remember. So I hope that everybody can able to help each other to learn about this so they won't get into the stage. 嗱，各位朋友，如果你話哇，我依家冇乜嘢啊，我依家都幾好啊，身體又唔錯，咁其實我唔使去做嘢咧，嗱，依個係好大嘅問題出現嘅，因為糖尿病真係冇咩嘅，所以叫糖尿病嘅問題喎，因為初期嘅糖尿病前期患病真係冇sign symptom嘅，即係好似好多人一樣。但係你2-3年後咧，你啲嘢慢慢出嚟啦。糖尿病啲嘢亦都2-3年後會出嚟嘅。咁呢啲嘢咧就譬如好似for example 啦，開始唔記得嘢啊，或者係眼矇啊，或者係which is like 青光眼啊，你個 nerve 開始 damage 咗啲神經系統損壞啊，呢啲咧全部咧係2-3年至5年裏面係慢慢出嚟嘅。所以如果咧，當你有呢啲嘢咧係真係要一出咗嚟之後咧係翻唔翻轉頭嗰度弊喎。So 咁希望咧，你就要降低血糖咧，你唔會變咗糖尿病者咧，變咗你就降低咗你中風嘅風險啦，失憶嘅風險啦，仲有唔會有青光眼啦，咁唔會心臟病啦，神經損壞啦，仲有咧你血管唔會硬化啦，咁變咗嚟講咧，你啲血壓會繼續上升啦，唔會斷咗隻腳，冇咗隻腳咧咪要斬咗隻腳，譬如啲嘢皮膚唔生翻嚟嘅，你就要真係減，即係要斬咗隻腳嘅喎，咁就要洗腎啦。同埋，當你係神經損壞嘅時候咧，你性功能都冇咗，因為冇咗 feel，咁好慘。咁所以咧，有啲人咧就是 pregnancy 咧，即係呢個懷孕併發症後咧，有一個 gestation diabetic，又係一個好大問題嘅。所以我哋希望咧做過呢咁多嘢之後咧，希望你全部咧都唔會變咗係呢啲咁嘅問題出現，對你係更加身體繼續健康，唔會有呢個糖尿病啊併發症出現。So our company really hope that。Reason why I'm doing all these, talk, hopefully that everything was sunk in. We have 5 programs helping you to basically, 1, diet control will teach you a lot about dieting and how to get low blood sugar diet, low cholesterol, low carb, low fat, and also how to drink LOWSUTEA. So hopefully with that, especially a pre-diabetic, that's most important because there are no drugs. It's just drinking the tea will help you out. Also, simple exercise, nothing very stressful. You can able to help you to lower your blood sugar by just simple exercise. With weight control program help you, and also doctor webinar like what we're doing today, and also how to measure blood sugar, how to assess, analyze your blood sugar. So that way, hopefully that you always keep your blood sugar below 6.4 and below, or you will get down to 5.7 of A1C. Always measure A1C. Or if your A1C now is 10 and above, it's okay. You will do all this, you will come down to lower to 5.7 or even below 6.4. So that is our goal. So you know our goal. I hope that you can able to all together achieve this goal together and you could be healthy. 各位朋友，嗱，我哋嘅用心咧，其實就希望咧，你係能夠我哋有啲計劃咧，係幫助你咧。係能夠有5個 program， 第一有食嘢嘅 program 啦，即係diet 嘅 program 啦，飲食啦，點能夠將啲低嘅碳水化合物食物俾你啦，能夠你亦都降低你膽固醇啦，降低你嘅fat 啦，咁同埋咧仲有咧係有6至飲去糖茶啦，每日飲6至8杯啦，有 exercise 啦，有weight control 啦，即係點能夠降低磅數啦。同埋doctor webinar 啦， 咁同埋點能夠降低你 A1C 由10去到5.7，呢個希望我哋做到，因為做到之後咧，你個身體一定會係健康，同埋唔會有第時嘅併發症。Okay, I'm catch up with all the people who just came in. I hope that this will help you out to at least understand what is, diabetes and how can you pre-diabetic can really continue to prevent yourself move on to a diabetes. So you don't want to be in diabetes. You want to be, if you're pre-diabetic, stay a pre-diabetic or revert back to the normal person. That will be your biggest goal you want to be. So that's what I try to stress. 希望各位糖友咧，或者前期患病糖啊，唔好去糖尿病嗰邊，繼續係努力係將你個前期患病繼續停留喺嗰度，或者去翻5.7嘅情況。So today, why I actually talk so much about pre-diabetic, diabetic complaint about constipation. Now, actually, constipation seems like a normal thing. Everybody have constipation, but diabetes definitely have more chances of constipation. And basically, they have, because there are more chances of constipation, and it can be something that is kind of, very bothersome. If you can't go, you always feel like there's something there. And the word says, studies show that 60% of diabetic experience some kind of constipation all the time. And the symptom can be very uncomfortable because it felt stuck, okay? So this webinar, we hope that will give you all these tips to help you to better understand what is constipation, first of all. Second, how to resolve, give you solution to resolve. Now, a lot of people don't realize you might need acupuncture, acupressure to resolve this because your nerve is getting damaged. So today, that part will be a very important part of the lecture, which is towards the end. You got to understand that, and you can try that. You don't need to be a diabetes to be even try that. Normal person that constipate also works, okay? So this will be sort of the biggest tip of the last part of the lecture. I think that you're all going to enjoy it and able to use it, and hopefully that you can able to help you to resolve your daily problem, because a lot of time people say, well, I can't make poop, and that can be really sad because you can't make poop, then you can really become a problem. So that way, we felt that we always have problem in sense of making poop. So anyway, I just want to let you know about some tips and technique today. Okay. First of all, I need to 各位同學點解今日做呢個 webinar 咧？個原因咧就係因為好多糖尿患病者或者前期患病者開始問我啦，喂，點解我去唔到㗎？因為去咧係每日嘅，即係人嘅腦裏面係每日一個人嘅習慣嚟嘅。如果唔去咧，你就覺得周身唔聚財，好唔舒服。嗱，所以變咗嚟講咧，個原因咧，原來60% 咧糖尿患病者係會有呢啲嘅便秘嘅情況係成日發生嘅。咁佢真係覺得好唔舒服，因為谷住晒，好唔舒服。咁有陣時咧，多數糖尿患病者已經開始老化嗰種嚟嘅，即係50歲啊、60歲以上啦。咁嗰啲腸啊又開始老化咯喎，咁嗰啲嘢唔喐得咁快噶咯喎，咁所以就加上咧就係呢個便秘更加多出現啦。所以變咗嚟講咧，呢個咧係一個常見嘅問題。咁希望今日嗰啲俾你嘅 tips 咧係能夠令到你咧係更加容易去大便。So today I hope that the tips will help you to actually get more easy way to relieve yourself, and you can be extremely happy and feel that, wow, I'm relieved. Okay, so that's what today's webinar help you. Now, first of all, I have to ask, do you know what is a sign of constipation? Okay, is it because I just could not go one day, I'm constipated? Well, the key is this. You have to understand how your bowel movement look like, okay? If your bowel movement come out, your poop is also very dry, very hard, and all lumpy. And later I'll show you some picture of the poop. You are actually become constipation. If your poop come out like a very nice banana type, smooth, that is not constipation, okay? And also, if every time you have to go, you have to strain yourself. Now, that is also maybe you're getting started constipation. Especially at age 60 and up. The straining actually is a risk to you, because I can tell you that. I was an ICU nurse in Hawaii. I have patients because of the straining gotten to what? A heart attack. And that heart attack, because they strained, they died. That's sad. And it's very, really scary. So you really do not want to strain, because when you strain, you increase what? Your blood pressure to the brain. You might have stroke. You might have heart attack. Couple of things. So when you get older, you really don't want to strain to go to your bowel movement, okay? Especially you're 60 and up. That is something that you have to watch. Plus, you have difficulty passing your stools, besides straining. You want to come out, but it doesn't come out. Or you come out look like etch of it. And that's very frustrating, because you feel like your bowel is there, but it never comes out. And then another sign and symptom is a lot of times that you felt like, I could not empty all of my bowel. You kind of halfway there. So kind of say, well, I still have something in there that didn't come out. And then on top of that, you're going to start getting some stomach hurting, and you couldn't get up. It's very frustrating, if every day you go through this whole thing over again, and then you feel bloated, and then you don't feel like, you couldn't come up, but you feel like bloated. It's like everything is there, And also, you poop less than 3 times a week. So you know where your poop is not coming every day. It's 3 times a week only. So you miss a couple of days. So all these are signs of constipation. Now, I have a client that's actually keep calling me sometime, and I'll help him out. And now he's relieved. He said every day when he go to bowel movement, he strain, he sweat. Now, certainly he's a big guy. So I can see his problem, his sign and stuff like that. So it took a lot of time. He doesn't exercise, doesn't take enough fibers, doesn't drink enough water. All those things come along. But the sign of constipation can be so bothering, because every time you go to the toilet, he sweat and really push. And I can see that can be a real issue. So hope today you first understand what is a sign of constipation first. And then following the next step, and let's give you all the tips how to do that and why does constipation occur. 嗱，各位堂友，便秘咧，你一定知道咩叫症狀嘅便秘。咁但係其實咧，你個便秘，你嘅大便咧係好乾嘅，一粒粒出嚟嘅，硬嘅，唔係好似 banana 咁嘅，唔係好焦出嚟咁嘅，係一粒一粒。因為呢啲咧，如果一粒一嚿嗰啲咧，就係開始便秘嘅開始啦。所以你嘅大便咧係應該出嚟係一條出嚟，好似真係好似 banana 一樣啦，好似香蕉一樣嘅。咁嗰啲先係好大便啦。咁千祈咧唔好要谷嘅大便，好似會谷出嚟嘅去到大便啊。咁呢個係危險嘅，因為當你60歲以上嘅人咧，如果你谷大便每一次要谷咁出嚟咧，你血壓會上升啊。咁有機會咧，有兩樣嘢出現嘅，中風啦，第一、第二咧就咩啊 ？heart attack 心臟病出發，兩樣都唔正嘅，因為你當你嘅時候咧，你血壓嘣升上去，可能去200幾度。咁如果你血管上面唔係好正仔咧，嗰個爆血管就腦出血咧，咁你就中風啦，或者心臟咪又有兩樣都有問題喎。所以千祈唔好去谷啲大便出嚟。咁如果你話我好困難咧，好似大便喺出緊嚟咧，出唔到咧，咁可能咧你又要即係飲多啲水啊東西啦。咁呢啲亦都係一個即係便秘嘅症狀嚟嘅。咁同埋好多時候好屙唔清啊！呢個又係一個好大問題，成日谷住喺度屙唔清，就係肚痛啦，又屙唔清嘅時候，咁就好似個肚脹晒咁啦。咁同埋咧每個禮拜即係3次大便咧，咁呢啲咧就係便秘開始嘅症狀，或者已經一路落去都係咁嘅症狀啦。咁你要解決，因為如果唔係咧，你個人 覺得好 frustrating 嘅，即係人哇好悶啊，我想要去唔到啊。咁我講啦，你講嘅都即係好多朋友傾過晒，佢講都係同樣嘅 answer。冇得去咧，係會周身唔聚財。所以希望今日咧教到啲嘢，就算你或者學咗之後咧，你去 share 俾你嘅朋友仔啊，或者你嘅任何人士都 OK 嘅，因為咧有呢樣嘢最低限度咧可以幫助你，幫到佢哋咧解決好多呢啲不咁容易做到出嚟嘅 frustrate， 即係可能 resolve 到嘅 frustrated 啊。So the issue is many pre-diabetic and diabetic clients are more likely to get constipation. 60% is a lot number. 60% get constipation. So this is why I want to make sure that you guys got some solution. 嗱，各位朋友，其實咧前期患病就糖尿患病者咧，60% 嘅人咧都有便秘嘅，咁呢個係好常見嘅問題喎。咁所以變咗咧，我都希望咧呢樣嘢俾到一啲 tips 你咧，係幫助你能夠以後咧容易做呢樣嘢，因為每日你都有大便㗎嘛，或者每2日咧就喺度。咁所以呢啲咧係希望做到一樣嘢東西咧，係幫助到你係能夠容易去大便。嗱，呢個第一。So really constipation. So you have to ask yourself, what is the normal stool? Now, if your stool come out piece by piece like that, single, lump. Now that is truly a constipation. It's type 1 constipation. It's hard, it's lumpy, one by one come out, small little one. So those are constipation stool. Now, second one is also not so good as you have lumpy and the sausage-like constipation. These are also mild constipation. So you don't want to have this first 2 type of stool that you have is not considered healthy because that's you got to take action. Now, the thing is, the third one is you have sausage type, but there are cracks in it, but it's still a very sausage type. That's okay. That's normal stool. The best stool is look like a banana come out, very, very smooth, and there's a big piece coming out. Those are good stool. Those are normal. Now, however, you have, bloat, a lot of, not by piece, but it's a soft, bloated one is, rough edge, meaning you have a lot of fibers, and that is basically, it's still okay, but maybe you can best to try to move enough fibers that you can make it like a banana. That'll be always a good stool. Now, if you become mushy and you can be watery, those are actually diarrhea stool, meaning that you have some kind of diarrhea. Now, you don't want to be in diarrhea stool all the time. The reason is meaning that if you have continued diarrhea, your nutrition are not being absorbed into your gut. So net result of that, eventually, if you have continued diarrhea, you're going to lose your electrolyte, like potassium. You're going to start getting jittery because potassium cannot transfer, electronic pulse to your body to act, stimulate, your nerve. So you don't want to continue diarrhea. Now, matter of fact, I have a client ask me, I cannot go. And he keeps eating what? Laxative. So his stool is not become form anytime. It will continue to become a diarrhea type of stool for 1 month or more. And I said, you got to stop getting that laxative because you don't do that, you are going to be malnutrition, you're going to come in trouble. And sure enough, his albumin coming down. The doctor said, hey, you are really getting sick because your albumin got so low, potassium going down. So end up, he has to stop his laxative and went to the hospital to just make sure that he doesn't get continued diarrhea. He had to get pills to actually get down not to diarrhea. So do not put yourself in diarrhea state and do not put yourself in constipated state. Try to get yourself in banana state. And banana is the best stuff you do. 各位朋友，嗱，記住，當你有糖尿病嘅時候咧，好多時咧你便秘咧就一粒出嚟嘅。咁呢個咧係一個唔正仔啊，仲有係好便秘啦。咁第二個便秘咧就係一粒但係條 sausage 啊，好一粒好難出嚟嗰隻。咁嗰個咧就係呢個咧 係呢個叫做輕微啲嘅便秘啦。咁但係重要點咧，其實你個大便咧係應該有一條腸咁出嚟，就算一粒粒，但係好 smooth 下嘅咧，呢個 OK 嘅，即係香腸，但係裏邊咧有少少裂痕啊，呢個 OK 嘅，即係你個大便好似有少少裂痕，但係咧都係一條出嚟咧，呢啲咧係正常大便嚟嘅。最好嘅大便就好似一條即係香滑嘅腸咁啦，或者一個香蕉咁啦。咁呢個咧又光又滑啦，又好似好smooth 出嚟咧，呢啲咧就好嘅大便嚟嘅。嗱，如果你係出嚟嘅時候亦都有光滑又軟熟，同好多嘢側邊走嚟好多一紮走出嚟嘅東西咧，可能咧就太多啦纖維啦。咁當然啦，你控制纖維咧，去翻最好就香腸大便啦，或者係 banana 大便啦，即係香蕉大便啦，呢個就好啲嘅。嗱，最差咧就係你開始有肚瀉啦，輕微肚瀉咧就係即係啲大便好一個糊漿咁出嚟啦 ，the worst 係成水咁出嚟啦。嗱，呢啲大便咧其實唔正仔嘅，點解咧？因為有啲糖友咧就去唔到，咁佢食咗咩？係食咗瀉藥啊。咁瀉嘅時候咧，瀉下就繼續係咁瀉，一個月都係咁瀉喎。咁一個月又瀉咗弊啦，佢啲 albumin 啊全部低晒，佢嗰個電質啊啲 potassium 啊鉀啊又低晒，咁 end up 要入醫院嘅。咁所以變咗嚟講咧，就唔好做呢樣嘢啦。其實最好咧就係我哋食裏邊咧能夠幫助我哋大便咧，係能到我哋大便咧係正常，最好嘅 banana 大便，記住 banana 大便啦。So most important, keep going yourself. Get your banana stool. That will be the best. Okay. So I hope today. I'm sorry to give you guys what a normal poop and not a constipated poop, but I thought this is important for us to understand. Now, the next step we have to understand what the cause of constipation. Why there's constipation? Now, studies show that the reason of constipation for diabetes or pre-diabetics, many of them is because 50% of these symptoms are caused by nerve damage. Because when you are diabetes, your nerves are being damaged now because, all the body or the gut, the brain, everything, the blood vessels are being clogged up. Eventually, nerves are being damaged. The symptom, the name of the damage called neuropathy, meaning that the nerve start damaged, and then especially on the digestive system also damaged. So end up you have difficulty moving your bowel, which is you're able to push this peristalsis, the food through the system and push it out to the body, right? So when the nerve damage, you're going to lose some of those functions. So net result of that, you are going to have difficult and you're going to have feeling bloating. Matter of fact, even can be, if you are so severe, you have diarrhea or vomiting. All these is affected your digestive system. So the first number one, if you have diabetes, most likely is because your nerve damage caused you to, that digestive functions are being impaired. Being damaged, so you can't move your peristalsis to push the food out through your digestive system. So you really gotta fix this, and later on I'll give you some tips to help you out on that. Because once you have nerve damage, you have to continue to stimulate back your nerve, and I will show you how you can do that. That's why this lecture will be very beneficial, and you can actually teach your friend. Very easy to do, and you can help you hopefully with that. It will help you to relieve yourself naturally every day. 嗱，各位朋友，因為可惜咧，我係糖尿患病者啊。咁多數咧，當糖尿患病者咧，佢有個問題咧，就係佢哋嘅好多咧，就有佢哋嘅本身嘅所謂嘅神經系統咧有損壞。嗱，當你神經系統損壞嘅時候咧，50%嘅糖尿病病人都有呢個問題喎，因為神經損壞咧就會 end up 咧。佢哋就會變咗咧，係佢嘅成個腸胃嘅控制個裏邊嘅腸胃嘅所有 nerve 咧都有損壞。咁嗰啲損壞咗之後咧，你啲所謂嘅呢個 paras 個腸嘅 movement 咧，就應該係咁樣咁 move 去呢個浪咁落去咧，就做唔得咁好啦。咁所以變咗呢啲嘢做唔得咁好嘅時候咧， 咁你就開始咧 end up 咧就會有便秘嘅問題發生。嗱，便秘咧唔淨止係有可能咧啲嘢出唔到嚟，有可能你會有即係出好差到嘅時候咧，你會嘔都有嘅，或者要亦都做唔到嗰個腸嘅 absorption 咧，就會 end up 有 diarrhea， 即係有個肚瀉都有嘅。所以呢個係一個好常見喺多數啲病人有呢個問題發生咧，係好常見嘅。所以呢個咧，咁所以今日咧呢個 nerve damage 咧，我會教你一個 acupuncture， 即係用指壓能夠 hopefully stimulate 翻你 nerve 咧，係幫助你咧係可以去大便。咁今日我就呢堂咧係會教多啲你嘅，遲啲會教你呢度啊。所以呢個臨到最尾係對你好有幫助㗎。Now, other cause of constipation is poor dieting, because many of the pre-diabetic and diabetic don't eat the right type of food, which result diabetes. Because first of all, they don't eat a lot of insoluble fiber to get regular bowel movements. Okay, so not enough vegetable, for example, a lot of big fiber, they don't eat enough. The worst is that because they were trying so hard to cut down the carbs. Because they want to lower blood sugar. But on the other hand, they lower the blood sugar, but they also lower the fiber intake. So they don't have enough fibers. So a couple of things in the diet, if they don't have enough fibers, like whole grain, also sometimes with fruits, for example, eating a pear or vegetable, that will cause them, guess what? Constipation. So you really need to eat more fiber, although you cut down your carbs, but you can eat low carbs, but with fiber vegetable and things like that help you mix up enough of fibers. It happened to a lot of my friends who talk with me at nighttime. They ask me questions, and including myself. If I don't eat enough fibers, you know what? I have a hard time going, and that is really true. And so really importantly, the fiber become very important, meaning vegetable fiber I'm talking about is, okay? So you got to make sure that you have a lot of those, okay? 各位朋友，嗱，記住，如果你係糖尿患病者或者前期患病者，你如果食唔夠你嘅纖維咧，咁你咧就會有機會咧係有便秘嘅。咁最弊咧，好多時咧，我哋好多糖尿病者就，我唔好食咁多。碳水化合物，咁你食咁多嘅時候咧，連埋即係有個纖維嘅食物咧都降低咗，咁你變咗嚟講咧唔夠纖維，當然啦係變咗便秘機會開始高啦。咁呢個 solution 最好咧就係點啊？解決方法就食多啲密嘅東西啦，多啲有 fiber 嘅東西啦，就算水果啦，或者食啲梨啊、蔬菜啊，能夠加啲纖維上咧，咁你嘅便秘咧個機會就少啲嘅。Now, the first one, remember we said is the nerve damage. The second one is you are not enough fiber. The third one is really dehydration, not enough water, okay? Now, a lot of people don't realize, normal person, you know how much glasses of water? We're supposed to have 15 cups of water a day. Normal person, not even diabetes, you have to drink 15 cups of water a day. 3 to 4 liters is your target. Unfortunately, we a lot of time don't even meet that. Majority of us, especially when you get older, we don't usually go drink water or drink tea, LOWSUTEA tea. That's why I so encourage people, you gotta drink 2 liters of LOWSUTEA tea a day, and you have 1 more liter drink other stuff, or another 2 more liters drink other stuff. It's okay, drink soup, whatever. It's good. So if you don't drink enough water, you know what? Your fiber and you don't have enough water to create bulk. You don't have enough water to create bulk, you are not forming your stool properly. If you're not forming your stool properly, it's very difficult to become a banana stool, right? Because you don't have enough water to create those bulk, okay? So importantly, you gotta really drink enough water, add up the fiber together to form your nice banana stew, okay? So if you can do that, you have a better way to form good stew, less constipation, and easy to go. But if you have not enough water, the stew become hard, then it become lumpy, look like a sausage, but a lot of lump, those are bad stool, and it's going to be difficult to pass out. So water becomes very important. Diabetes, you really also need the water to flush the additional sugar out from your urine, besides your constipation, besides help you to constipation. You should get pee more often so you can able to get the sugar out, especially if you drink what? LOWSUTEA. When you drink LOWSUTEA, you will pee. You know what? You dump your sugar out. And you can actually, if you have a ability, it would be nice to when you get one of these. You can see if you drink LOWSUTEA, you after you go, you know what? You will start seeing your blood sugar coming down to a very nice level. So really, at the end of the day, you gotta see yourself, and you can see, you know, look what happened. It's 6.0, because after I drink LOWSUTEA, you know, sugar comes out, and 6.0 is about 90, 100, around 100. So a milligram per deal. So really, at the end of the day, if you drink enough water, you'll pee more often, so you'll get rid of sugar through the urine. So sugar will come out. However, a side effect of that is you also, because you keep peeing, you also become dehydrated. So when you have both, you drink a lot of water, you pee, and you don't drink enough water, but you drink some water, and you start peeing up because you got dump up the sugar. Your bowel have not enough water. Guess what? You are going to have constipation. So the constipation become dehydration and not enough water makes your bowel movement, the bulk, then the problem occur. Okay. So the third thing again is dehydration, and your second thing is fiber. The first thing is nerve damage. So now you know 3 major reasons. Now the fourth reason is medication. Now some of the medication you take is like calcium channel blocker, lower blood sugar, and some of the nerve pain managed is also will cause constipation. So these are the two major drugs can be caused. So you do have that. Make sure to tell a doctor to change the medication to help you not to get constipation. 嗱，各位堂友，頭先講咗啦，第一種咧就係我哋有 nerve damage 咧，即係個神經系統損壞啦。第二種就唔夠纖維啦。第三種咧就缺水啦。嗱，缺水咧一個好大問題嘅，因為水咧係幫助你嘅糞便咧係 form 咗啲正啲嘅大便。嗱，如果你有夠水咧，你嘅大便就唔會 crack 嘅，就會好 smooth 嘅，就好似即係香腸出嚟，或者 banana 好似香蕉咁出嚟。但係當你唔夠水咧，弊啦，你個大便咧就會一粒就一嚿大多一粒，好難出嚟嘅。有陣時將一杯出唔到嚟，因為唔夠水。咁仲有一個問題咧，當你係糖尿病病者飲咗譬如依水嘅時候咧，係多數咧你個尿道咧會走多啲尿出嚟嘅，而咧個糖咧係希望個身體咧將糖排泄出嚟。咁變咗嚟講，你飲唔夠水咧，咁個問題咧，當啲糖掉咗啦，咁但係唔夠水，嗰啲大便咪越整越就硬啦、結啦。咁所以咧唔夠水係一個係好 important 嘅問題。嗱，每日咧其實應該有15杯水，就普通人嘅喎。咁其實一日咧你應該有3公升類3個 litre 嘅水。最好飲到4公升啦，飲唔到3公升係重要嘅。所以應該介紹你飲去糖茶咧，去糖茶係俾你每日已經飲2公升嘅去糖茶啦，再加埋1公升嘅其他水咧，咁就幾正啊！即係你一定會飲夠水咧，幫助你有大便啦，同埋亦都乾淨嘅水唔會變咗係脫水嘅問題啦。咁仲有咧藥物啦，藥物咧亦都會令到你可能有結宮嘅。有啲藥物咩藥物咧？就好似 for example 啦，呢個降低血壓嘅藥物咧係會有機會咧能夠你結宮嘅，或者有啲食嘢係有減低你嘅神經係痛嗰啲藥咧，亦都會有結宮嘅問題。咁你話俾醫生聽我有結宮問題啦，咁佢就希望轉你嘅藥咧，唔會俾你有結宮。所以呢個兩個係要一齊用嘅。Okay, so now we talk about all the cause of constipation now. So now we've got to figure out how to resolve your constipation. And so we had mentioned some already, and I want to make sure that everybody will have a consolidated information. So you can able use your regular remedy without drugs to get your constipation control. The first thing is certainly you have to control your blood sugar, so you will not get further damage, blood sugar further nerve damage. Okay, so you really don't want to have nerve damage, so you got to control your blood sugar, like your diet control with low carbs, all the good stuff that in blood sugar. Besides diet, you do your exercise, regular exercise. You gotta do, walk 10,000 steps. You have the high fiber food. Okay, so make sure that you have whole grain, fruit, vegetable. Remember, half bowl or half plate is all vegetable. That's what I suggested all the time. Follow that. And then, very important, drink 2 liters per day of LOWSUTEA, because each day is about 3 to 4 liters of fluid. And also, LOWSUTEA also do have fibers and help you to keep hydrated and form bulk of your stool. So your stool continue to become banana looking. Now, one more thing is very important. When you feel like your brain said, I want to go, your bowel movements at go, and usually I always go at the same time, like every day you go at 7 a.m. or every evening at 10 p.m. Maybe, I don't know, it's all individualized. If you want to go those times, become regular, do it. Or if you just gotta go do it time, go do it too. So whenever you gotta go do, don't hold it, because when hold it, the stool will reabsorb all the solution. End up, your stool become dry and hard to push it out. So make sure train your bowel movement a regular schedule. Whatever time you are, it's okay. So you can go. Or you feel like to go. Don't hold it down. And then so you want to make sure that you want to get maybe a footstool to lift your leg up and you move forward, so you can able to get a very comfortable position to do your bowel movement. Now, if you also get your bowel movement, make sure that you have enough time to do your bowel movement. I know a lot of people say, oh, if I rush, I can't do it. It's true. When you're nervous or rush, you cannot do your bowel movement. You have to be really relaxed the time to go. So make sure that you are actually in a relaxed stage at a time that you can give you more time to do your bowel movement. Go do it. Don't put yourself in a rush area. Last but not least, it's so important to get your acute pressure reliever. And I'll show you how to do that in the next slides, because that will really help you, because of nerve damage. You have no medication, so you have to re-stimulate your nerve, and I'll show you how to do that later. And that way, hopefully with that, those little tool set will help you to release your bowel movement much easier. 嗱，各位朋友，我知咧，頭先講過啦，其實都開始有些少話俾你聽，點樣能夠喺屋企裏面咧醫治你個便秘。第一，你一定要控制你血糖咧，解決咗你嘅腸嗰啲所謂叫神經系統嘅損壞。咁當然啦，呢個咧係好重要嘅，降低血糖就即係你個卡要食得少啦。嗱，一定第二樣嘢啦，你要開始咧去 exercise 啦，因為 exercise 亦都降低血糖啦。咁亦都你個 fiber 食嘅纖維嘅食物能夠多啲纖維食物，咁亦都令到你 form 你嗰啲便咧個大便咧係一條臘腸咁樣，一條banana 咁樣，咁呢啲就好嘢嚟嘅。咁同埋咧好重要飲夠水。嗱，飲水咧係一個重要點，就係因為有水咧，你先能夠 form 到你個 bulk of the stool， 即係嗰個大便咧能夠一條出嚟嘅。咁所以咧，我一定係 recommend 你多啲咧飲你去糖茶啦。點解要飲去糖茶咧？ 有2公升嘅茶一日要飲嘅。咁你飲2公升，你仲有1公升咧，即係每日應該飲3公升嘅水，係每個人都要嘅。咁就要飲3至4公升都 OK 嘅。咁飲2公升，你仲有1公升係飲其他飲品都 OK 啦。咁所以咧，飲夠水2個 litre 水係好重要，因為亦都喺去糖茶裏邊咧，亦都有好多纖維，並且防止咧你缺水。咁所以咧就亦都希望你做到呢樣嘢，你啲水分咧能夠 formulate 你個嗰啲大便能夠調出嚟。咁仲有啦，好多時咧你去大便嘅時候咧，你希望你有個即係習慣一個時間去大便啦。好似好多人就去嘅大便嘅時候就係朝頭早7點鐘啊，或者夜晚10點啊，唔緊要嘅，你咩時間咧？但係最緊要去嘅時候就係去。千祈要去嘅時候唔好忍咗之後咧，你大便可能嗰啲水分咧吸收翻入去嘅時候咧，咁就硬咗咧就好難出嚟噶啦。咁一定咧，同埋仲有一樣去嘅時候咧，俾多啲時間，你要知道係好舒服嘅，要 relax 咁去。因為如果你急咧，未必去到嘅。所以變咗呢啲又係一個好特別嘅東西。嗱，一陣間咧我就教埋你咩係做手指壓咧，係幫助你咧去。令到你咧係知道咧係用呢啲咁嘅手壓嘅方法咧係 stimulate 翻你嘅 nerve， 咁應該會繼續解釋。So all these home remedies definitely will help you, and hopefully with that you can able to continue to help you to relieve your bowel easily. Now certainly. A lot of people say, well, I can't go. Maybe I should do laxative. And maybe I could do that and that will be easy to go. Now, certain laxative can only do a very short term, for example, 1 or twice in few months. But not to do it all the time because you can also, some laxative can also spike your blood sugar and also is not for long-term use. And you don't want to continue to have that because if you continue to have diarrhea, for example, or keep coming up, so net result, you might actually lose, absorption of nutrient. Your albumin go down and your potassium go down, and it will really rack up your entire body electrolyte. So you don't want to do that using laxative as much as possible. Hold the laxative, do all the home remedy first, okay? So certainly some of the item you want to make sure you can do that is your laxative should be forming is the bulk forming type of laxative. Forming bulk laxative is going to be something like metamizole. You can buy from Longs or Safeway or Costco. They sell metamizole a lot, and that can be forming bulk, and that can be used, but not using all the time. But that is a good stuff to do. Okay, and certainly if you're getting more and more, you might have milk of Malaysia. You have to Ducalax, other stool softener. For your more severe constipation. Now, but keep in mind, you only use it once in a while, not long-term use, especially like Ducalax. All these things are really, really for more of true severe constipation. So this could be used few months one time, yes, but not to do it every day. As I say, my friend did it so often, he ended up to the hospital. So you don't want to do that. 嗱，便秘還便秘，但係食藥嚟瀉咧，係唔係一個好方法？千祈唔好係長遠嚟食，因為咁做法咧係令到你身體咧更加危險咧。end up 佢所有 electrolyte 就冇晒啊，所有啲嘢唔好啊，會入醫院啊，呢個係唔好嘅。咁當然啦，你話每幾個月食一次冇問題。但唔好日日食或者成1個月食個月食咧，呢個就有問題大啦。咁好多時咧，我哋食呢個嘢咧就可以食一啲呢個 metamizole 啊。咁呢個喺 metamizole 咧就喺藥房咧賣嘅，佢將嗰啲大便咧整到一個香蕉咁大啦，咁能夠容易出嚟啦。咁呢個咧係食咧就可以得嘅，但係就唔係成日食嘅。OK， 你間中食 OK。咁如果你話食啲藥咧，好似 Ducalax 嗰啲咧，即係淨瀉藥嗰啲咧，就唔好啦，因為呢個係會令到你瀉咧。咁如果你繼續食咧，就令到你腸可能夠即係要依靠咗佢咧。第一，第二咧，尤其是你個腸搞壞個腸咧， 你繼續係咁錫咧，你營養 absorb 咧，咁你問題就好大嘅。咁呢個咧就食呢個瀉藥咧，真係要小心啊。So keep in mind, do not use laxative frequently. Once in a while is okay. Few months, once in a while is okay, but try to use a home remedy first. Now, more important now, I show you this is the most important part of my lectures, where I think that acupressure relief your constipation will be a really important task. I hope you can all learn. After you learn that, you can teach it to your friend. It's okay. Now, keep in mind over here, you see this spot? So use a finger like this, like L shape, like you press over here, okay? And this is you pressing the thumb index finger. Can you see? So you can either press right here in this part. This is the crease part. And then you press, and then you can press about 1 minute, and you deep breathing in both arms. You press this right here. You do 1 minute deep breathing, continue to press. That will actually stimulate both your intestine to go really move your peristaltic to move. Now, however, one risk, if you are pregnant, do not do that, because this is the stimulation of your inducing labor. So you can do that in here also. Again, press your finger, close like that. You see a finger, and you press right here, same thing. And you press it down for 1 minute, and you deep breathing, and that's what you do in this right here. Right in between this thing, you close your finger, and this is the part you press down. Maybe you can practice yourself 1 minute, but you don't do that if you are pregnant, because this actually induces labor. So keep that in mind. That's 1 minute, okay? Now you can do after 1 minute, it will also can do another one, which is right here. You see this crease? This crease right here, you press down here is also stimulate your using this thumb as like L shape. You press it down here. This is stimulate also your large intestine on this side of the arm, and you do it 1 minute, and you do deep breathing, continue breath, and you do deep breathing as continue breath 1 minute, and you do the same thing on this arm, same thing here. You see this crease, this part, and using your thumb here, press it down like an L shape, and press down 1 minute, okay? And you can bring you press this, you can feel your bowel gonna start moving, okay? Now certainly, if you have both arms start doing it after 1 minute, and then you can use this index fingers here and press same place and both at the same time. Now this is really truly a stimulation acupressure to help you to stimulate your large intestine to move. After you press it a while, you know what? You're gonna start feeling something, your intestine moving. Now, the last one is the most powerful one. This is your left arm, left hand. And left hand, only the left hand, left. No? And then you can see your ring finger and your pinky finger. You see this part? Okay, and you draw a line down here to your wrist. And the wrist, that's the tendon here. And that's the tendon here. And this is the part where there's the dip. And this is the most powerful to actually stimulate your bowel movement. I found when I did this, every time works. After I did this 3 movement, my bowel is going to move and it's going to stimulate. And use this finger to push forward, upward. And you can do this about 10 times, slowly moving up. And your bowel, you're going to feel something moving already when you do that, okay? You see this? Only the left arm now, not the right arm. Left arm. Left is where you watch arm, okay? And you guys do moving up gradually. You do 10 stroke, continuously do 10 stroke. And you do that continuously, you know what? You're going to start feeling a bowel movement. Now also, actually, this one will also help you on anxiety, emotional issue. If you feel anxious, you can do the same thing here too. So it's a very powerful acupressure reliever here. So you can do this. You know what? You will feel, I feel like to go. And after you drink enough water, you will feel really ready to go. It will be excellent to help you. So all these steps, as you know, the first problem what you have, your nerve damage. Your nerve is not that sensitive anymore. So I hope we can use acupressure to improve your nerve, to stimulate them to start moving again, so you can able to move. So keep that in mind. First is this, Chris, over here, right? And you press down with a thumb with an L shape. Press both arms. Deep breathing, 1 minute, okay? And then you go do this arm, same thing, close it and press it down, 1 minute. And then the elbow right here, from the Chris, and then you can do the same thing, 1 minute, breathing, and then you go deep breathing 1 minute and do this for 1 minute also, this side, okay? And then you're gonna do both hands with 2 arms, do this, and you can do both parts, do the same thing, and 1 minute. Now your bowel is gonna start stimulated. Then last but not least, this is your left arm, and using the ring and pinky finger coming down, right here, the tendon, a little dip, move upward, stroke it 10 times gently, and intensify the pressing. You will feel the bowel start moving. And this is a very powerful, nerve acupressure here. Can help you stimulate your bowel. And if you sometimes anxious, you can also, like anxiety, it also help you to, relieve your anxiety. So this is actually a very good way to move your bowel, peristalsis, to move your guts, all the stuff forward. So today, I hope will give you quite a bit of tools to help you, one, for pre-diabetic, pre-diabetes and diabetic who have common problem of constipation. Now you have all the tips to understand why, because nerve damage is number one. And the second is maybe you're not enough fiber. And the third one, you don't have enough water, hydration. So this is all going to help you out to continue to give you, relief on, the cost of your, we'll give you a tips to help you to relieve the cost of the constipation. And we talk about already, if you cannot go in 3 weeks, 3 times a week, you only have, stool 3 times a week, your stool become lumpy and is piece by, one piece by one piece, that is a sign of constipation. And then you need to, basically with that, you really have to have your diet by, fiber diet, water, more exercise, and you need to make sure that drink a lot of water, be hydrated, and you might want to drink LOWSUTEA, because LOWSUTEA can give you at least 2 liters worth of water. Each day is about 3 or 4 liters, so you got half of that already done, and you will not be dehydrated. And then last but not least, use acupressure to help you to improve your constipation. So I hope all that will give you a good insight. What is constipation? How it causes? What can you do to resolve this? So hopefully you have wonderful relief every day. 各位同友，好高興啦！今日有機會咧同你解釋到乜嘢叫便秘啦。嗱，知道便秘有3大元素咧，第一係會令到你便秘，第一就係你有 nerve damage 啦，即係神經系統係損壞咗啦，做唔到即係對個成個腸臟嘅運作啦。第二樣嘢就唔夠纖維，食物纖維啦。第三咧 就唔夠水啦。咁呢3樣咧係一個重點嘅東西嚟嘅。咁所以咧，其實咧重點我哋都知道咧，如果你啲大便咧係出嚟一粒粒，咁一定係會係即係便秘啦，同埋每一個禮拜3次先出到嚟嘅，咁就每一次好辛苦出嚟啊。咁呢個一定係便秘啦。咁有陣時咧係糖尿病病者、前患者好多時咧就真係因為佢哋食嘢唔夠個 diet 方面咧控制得太厲害，咁連自己個 fibre 都唔食。咁我哋多數咧就最緊要咧喺我哋個 treatment 裏邊咧係要有咩咧？係食多啲 fibre 嘅食物啦、whole grain 嘅食物啦，同埋啲生果同 vegetable 啊，咁同埋要有夠 exercise 啦，同埋咧就要飲多啲去糖茶啦。嗱，其實飲對糖咧兩毫升嘅去糖茶已經做咗你一日嘅嘅水分啦，咁你就即係有 dehydration 機會唔高啦。咁你仲有1公升嘅水係飲其他嘢都得嘅。咁同埋咧有去糖茶喺裏邊亦都有 fibre 幫助你去更加去多啲纖維喺呢個大便嗰度。咁同埋咧仲有咧就最重要咧就係你個指壓嗰度咧真係會對你係有一個好大嘅幫助嘅，因為指壓係幫助咗你咧係能夠對 nerve damage 咧你係冇藥食嘅喎。咁呢個指壓咧係能夠 stimulate 咗你 nerve， 能夠令到你更加係容易去大便。So today I hope that will give you not only a good insight, but you can actually practice and teach your friend, especially acupressure, and help you to end up make it easy treatment for your constipation. So I hope that you have a good understanding now. So hopefully every day now you can relieve yourself naturally and easily. If you have any question, I'm here to answer any question, and hope that you folks are really appreciate on your Saturday, on your Friday night in US, get able to spend the time listen to all these webinars, helping you to better manage your diabetes. So, are there any questions from the floor? I can answer any question for you folks. Matter of fact, I have a question from one of the elderly ladies that asked me ahead of time. One of her question was, every time I go, I have to go to push. Would that be a good practice? And I told her, no, not a good practice. And I got to tell you a real story. And this is my mom, my own mom. I told my mom, and she's 87 years old. I said, Mom, you got to take Metamucil to form bulk to push your stool out easily. She said, oh, no, I don't want to do this because, when I go to church, I got to go poop. It's so embarrassing. And it's not good for me to do, go stool in the church, to go poop in the church. I said, Mom, you got to do this because you don't do that, you're going to have stroke. And you stroke, you're going to die. And that's not good. Unfortunately, she is stubborn. She didn't want to listen to me. And you know what? She went to church one morning, 9 o'clock. She has to go. She cannot go. She pushed. And she truly got a stroke. And when she got a stroke, she had massive bleeding. And 5 days later, she died. And that's a true related story for me. And I really want to help many of my friends. And I help this lady had asked me, should I push? I told her no. I saw this when I was ICU nurse. I know this is truly a risk. Unfortunately, people just don't listen. And that is the issue. So I hope everybody really do not force, because we don't know how weak our brain vessels is going to be and when it's going to crack and bleed. Once you have a stroke, the bleeding, when you are 87 years old, the bleeding will go wherever, can damage the brain. It will be tremendous expenses, tremendous healthcare costs, tremendous suffering. And I don't want you to be in that stage. You don't have to be diabetes or not diabetic. It's the same thing, because when you have a stroke, you are not able to move. The recovery long-term healthcare costs tremendously. And I have sampled so many different samples of people that I know, my patient and my friend has the same issue. So constipation can be a tremendous healthcare cost if you are not able to take care of. So I hope this story can relate to many of you, and because it relates to me, because my mom died because of stroke, because she has constipation, push, and blood pressure goes up, maybe 200, 300 during the range. We don't know what's the blood pressure, but that created a stroke. And 5 days later, she died. So I hope that is a true story, help you to let you understand constipation as we got age cannot ignore. So be good health, be easygoing. I hope that you have a wonderful weekend. Thank you very much, everybody. I'm looking forward to talk to you soon next time. You take care. Thank you. Bye-bye. Everybody have a nice weekend.